Good evening. My name is Matt Snuffer, and for my demonstrative speech, we're going to learn how to start an IV. This is a critical skill for nurses and paramedics. Um, Before starting an IV, we should have identified that the patient has a need for or would benefit from IV medications or fluids. Once we've identified the need, we'll go ahead and get our equipment ready. We should be uh, wearing gloves to kind of isolate us from any bloodborne pathogens that we may come in contact with. Make sure that we've selected the appropriate IV catheter, got us a start set, and you want to try to keep somewhat of a sterile field as you're setting your site up. Um, Proper IV fluids, you want to check and make sure they're in date and that they're clear. In this case, we got normal saline, and you also want to make sure that there's no contaminants floating around in there. And I've already went ahead and prepared that with our IV line, and everything's ready to go. With the IV line, after you spike the bag, you want to make sure you bleed out all the air so you don't create an air embolus. All right, so I like to start down low, work my way up the arm. Uh, One of my favorite places is the hands, but a lot of people like the forearms. And what you're looking for when you're trying to select a vein is to make sure that it's large enough to hold the catheter that you're going to be cannulating with. And um, I find that the ones that have a little bounce or are spongy tend to perform the best. The flatter veins, they like to blow a lot if you can even get in them. So they tend to lie very superficial against the skin. So once you've identified a suitable vein, you want to take your tourniquet, and it needs to be approximately 4 to 8 inches above the site. And I think for this demonstration, we're going to go with this one right here. You want to use betadine or alcohol pads, anything that is kind of a aseptic cleanser. And when you're cleaning the site, you'll start inside and work your way out with circular motions. And then just taking one swipe down the middle. Now with your IV, you'll notice that one end is kind of beveled, it's really sharp, and the catheter kind of slides around the needle itself. You want to make sure that that's loose and hasn't gotten stuck in the packaging, so that when you actually penetrate the vein, you can slide it off fairly easy. You can take your other hand and take your thumb and hold traction against the vein itself. That will kind of keep it from rolling around on you, make it a little bit easier for you to penetrate the vein. You want to go in with the bevel up at about a 45-degree angle. Now, once you penetrate the vein itself, you'll feel a change in resistance. Some call it the pop. You should see a flash of blood enter back through the catheter and into the back chamber of the IV. Once you see that, you can lower your catheter, advance it just slightly, just a little bit to make sure you're well within the walls of the vein, and then slide the catheter off of the needle. And you want it to rest tightly against the skin. Go ahead and pop your tourniquet. Using my two middle fingers here, I can close off the vein just above the site, kind of tamp it off, put some pressure, and with my other two fingers to hold on to the hub of the catheter itself. Pull out your needle, dispose of your sharps, attach your line to the hub of the catheter. You want to open that line up, kind of flush it, make sure that the IV is going to be patent, it's going to flow. Your patient should not feel any burning or pain if it's done correctly. Take our occlusive dressing,
Mama, I know to
This is going to be clear. It's going to allow us to kind of have a window to look at the site, reassess it over time, and make sure that there's no redness or swelling, any signs of infiltration. Now once I got that on there, I can kind of let go of that just a little bit, long enough to give me some tape and secure it so it don't get pulled out. And then with the IV line itself,
there's some more.
you can just come above your site there. And that way, if it was to get hung on something, it shouldn't get pulled out. So, in summary, that is basically how you gain intravascular access. Thank you.
Very good.